I'd like to just say here to start with is I'd like to thank Chairman Kolb. I'd like to thank everybody in this room. And not only on behalf of policing and the CACP, but on behalf of all of our communities, because this is how it starts. Everybody that's taking the time out of their day to actually look at what we can do different to make where we live better. Don't lose sight of that. It might not be a big change, it might not be a small change, but the reality is why we're here is we're looking at how we can do things better, and I think that's a refreshing place to come from. I want to tell you that what I'm going to speak about today isn't a police presentation. Lots of it applies to what I am and what I've maybe put in for slides, but this is a presentation that's been given across this country numerous times, not only by myself, but some of my colleagues in social services, health, education. And in fact, when my police people do this presentation, I don't let them do it in uniform. Because I really think policing is something that we've went from leadership into ownership too much, and we need to start looking at really what we should own and what we should look at and how we can change the system itself. What I'm going to talk to you today about, we're 3 years into. This didn't happen overnight. This is a bit of a shifting, a change in thinking, but it's common sense. But not, unfortunately, not common practice. But when you look at that and you start thinking about that, obviously there's a lot of things when we look at our business and how we can do our business a little bit better that we have to ask different questions. And some of the things that I'll speak about today will exactly refer to that. So a little of my background. This started putting pen to paper. This says Community Mobilization, Draft 18. It's probably on about Draft 32. It's a living document. It changes every day. That's the world we live in. But the reality is, this is where I was in Boston on a police leadership course put on by Harvard and Boston instructors. Perf, Chief Torgen's been there as well. And what it did is give me time to work on the business rather than in the business. And there's a big difference. Getting off the balcony, or sorry, off the dance floor on the balcony and actually look at what's driving your business and look at how can we change that? What can we do different? How can we have better outcomes? And I think the key to success from my personal view and personal opinion is that you have to be able to look at it through multiple lenses. If I'm a chief of police, which I am, as Matt is, and others, my colleagues in this room, is we need to be able to look at some things through different lenses. And when I have bullet 2 on there is I'm an entrepreneur. Been an entrepreneur for probably 15 years. I moderated a group of entrepreneurs in Saskatchewan up to about a year and a half ago, anywhere from $5 million in sales to $250 million in sales. Kind of a who's who of up-and-comers in Saskatchewan, people that think differently. And I only tell you that because it's not relevant other than to be able to look into it through another lens. And then the third lens that I want to put on there is about 3 years ago, I accepted an appointment from our premier to the health board, the regional health board. And I think to me, that was that aha moment that said, you know what, we're missing some things here. On a collective expertise and a collective wisdom, how we can actually change the game that we're involved in. And when you look at that, and when I'm going to speak about that, I want you to keep in mind that I'm not just speaking as a chief of police, I'm speaking through other hats that I've personally had the opportunity, I've been fortunate to wear, but thinking when you're looking at the bigger change, it's going to be more than policing. So setting the table, my police trends, I'm a smaller community, third largest in Saskatchewan, but I'm in middle, located geographically in the middle, basically called the north. I have a reverse demographic. The highest portion of my population is 15 to 24. The next biggest segment is under 15. Crime is going up, back to Dr. Waller. Social issues are rising. The reality, our calls for service are going off the charts, and we just can't keep up. So we need to look at something in our system that we can slow down the inputs. That's the only way that if we look at this, and I'll get to some of the comparators, that we're reasonably going to be able to keep up. That's a black swan. And if you ever want to read a bit of a deep book, read The Black Swan. It's about dealing with anomalies and the ability to make change through innovation when you have an anomaly. In other words, all the swans at one point were white. Somebody found a black swan. Oh my God, what do? It's a black swan. Somebody got their head together and figured out, okay, it's different. Because it's different, maybe you can do a lot of the things the same to have the same result, but you might have to use innovation. You have to tweak the way you're thinking. And that's what Northern Saskatchewan is. Our pulp mill closed. It was doom and gloom. It was a high employer of roughly 1,000 people, all the subsidiary jobs in the 4,000 range. At the end of the day, people said doom and gloom. PA is going to collapse. You know what? Retail sales in Saskatchewan and Prince Albert went like this. Why? Because we realized that we're highly influenced by Northern Saskatchewan and the transient population. Now, with the transient population comes good and bad, but the reality is if we're going to capitalize on the social, or on the domestic economy, Maybe we have to connect it to the social economy. So when in Rome, live like the Romans, or more importantly, how do we marry the two together to get the results of safe community and thrive in business? So those were our arrests. When we started this over 8 years, so this is 3 years ago, our arrests were going from 2,950 to 6,800 in 8 years since I became the chief of police. Often the chiefs in this country, and I use it often, we're not going to arrest our way out of our troubles. But we never ever say that we're going to stop arresting. And there is a difference. Back to what Dr. Waller said, there's people that need to go to jail. And at the end of the day, they get rehabilitated in those jails and they can exercise those programs, because in the jails there's really, really good programs, Courage to Change, especially the federal institutions are doing a great job. But really, all of them shouldn't be going to jail, and that's what we're going to talk about. So to put that in perspective to you, Saskatoon and Regina, who are the two largest cities in Saskatchewan, roughly arrest 11,000 people. They're 5 to 6 times bigger than we are. 5 to 6 times. So that's an anomaly. That's off the charts. We better start to think different, or we're not going to obviously be impacted. And back to what I was telling you about the demographics, 15 to 24, largest segment of our population, under 15, next biggest segment of our population. 32 to 42% of our arrests, Prince Albert Police Service, are from outside of our city. Another anomaly. Outside of our city. So when you talk about that, what does that mean? Well, it means that the feeder system is Northern Saskatchewan. 8 to 10 years, Northern Saskatchewan is going to be 50% under 15. Not 50, 15. So we need to look at a solution for 2 reasons. Slow down inputs, because the crisis is coming in. Something that's going to be more cost-effective and more efficient and drive the bottom line of what we're trying to attain. So basically 2 reasons for doing this presentation. I'm going to go reasonably quick because I want to get how we got there into where we are today, so you get a little bit more of the full picture. So I've incorporated 2 presentations here. So Norm Taylor, who a lot of you in this room know, is working, and I'm the president at the time of the Saskatchewan Association of Chiefs of Police. The province is working on what they called the future of policing discussions. We're into this 2 years, we're not doing anything, we're basically not getting anywhere. We need to focus these discussions. The first point that we tried to make is we need to be the future of community safety, not policing. So when they did that, at the same time we were doing that, we were paralleling this in Prince Albert with what we were finding, because we thought we're in an urgent situation, we have to look different. Norm Taylor comes up to Prince Albert, sits down with my deputy and I, and he basically has a chat with us. And the province allows him to work with us on our strategy. So I say to Norm, Norm, surely to heck somewhere in the world has had the same issues we have, and surely to heck somewhere in the world has had some successes. Where do we go? Where do we go? Well, he gives us 2 examples. First being Africa. Can you imagine if I went to my police board and said, I'm taking a team to Africa? There you go. Expenditure versus investment. How do we reverse that argument into investment versus expenditure? Because there's a huge difference from a business component. But then he says Scotland. Then okay, Norm, I kind of like that. It's a little closer. People might be able to relate with that a little bit, but why would we go to Scotland? And why would we take a team of 11? We took social services senior manager, we took mental health and addiction senior manager, we took education superintendent, the RCMP 2IC, we took 4 of my people, my bylaw manager, my family safety unit officer, and my IT manager. We took somebody from our regional and sectorial, the committees, all the groups that get together, the chair of that. And we're going to go, we had a policy analyst from government, we're going to go to Scotland. Obviously, we have to sell that, and that's a whole other story I could get into, but let's talk about why. Alcohol usage, disproportionate in the UK, one of the highest in the UK. Low life expectancy. The area of Glasgow we studied, one of the lowest life expectancies in their comparators. Youth violence, disproportionate. Everything in Scotland's 24/7 CCTV camera. They showed us pictures of kids fighting with crossbows. Kids! And they're real crossbows. They're not even made up. They're shooting at each other. Youth violence, disproportionate, way out of whack. Domestic violence, national crisis. They have all kinds of programs because it's way out of whack with the rest of the system. Teen pregnancy, extremely high. Drug usage. They have every type of drug, same stuff we use, and of course disproportionate, high usage. Education standards, below average, one of the lowest comparators to theirs in the UK. Gangs. In the Glasgow area we studied, they had 177 territorial gangs. Now the difference between their gangs and ours are you're born into by name or you're born into with the street you live on. but they're still involved in organized crime, they're still involved in perception of crime, and all those things that are associated with the gang. So there's still a lot of similarities to what we face in our own communities. One Scot dies every 3 days from alcohol use. Housing problems are a national crisis, both on quantity and quality of stock. How many times have we heard about housing already today? Knife violence disproportionate, it's the weapon of choice. Just saying we might go into one of the taverns for a pint, all these young kids had big scars on their face. Before we were there, there was a group of plastic surgeons from across the world there studying their trait. Why? Because in their emergency wards, every few minutes they have a case. The knife violence is disproportionate. That's where you go to study because you have hands-on training. HIV, Hep C, disproportionate, again out of whack. High suicide rate, especially among young people. Parts of Glasgow where we studied had 83% unemployment. 83% unemployment. So when you look at that, that's us. 15 key indicators that are exactly the same as us. So my light bulb moment when I was there is I come back, I'm a highly First Nations community. I'm Métis. 40% of my police service is Aboriginal. But when we look at this, we've been unfairly, in my opinion, painting their issues on First Nations. Because Scotland has all the same things. It's a white homogeneous society, very little movement. First presentation I did was a group of chiefs at our Prince Albert Grand Council, 12 First Nations chiefs. One of the chiefs challenged me, he says, Chief, that's all good for you to sit up here and tell us what we need to do as First Nations people. I said, Chief, I'm not telling you that. At all due respect, the relationship we have, what I'm telling you, here's 15 things that are the same as us. Our issues aren't First Nations, they're marginalized people and all those things associated with us. And unless we collectively start looking at this together, we're not going to have a favorable outcome. And in Scotland, they formed a GCAS, Glasgow and Community Safety Services, and they've had 6 years of crime reduction and enhanced community safety. So when we took our business plan to Scotland, and I'll talk about this later on, we didn't go there just to bring their program back. We went there to find out what works with theirs, how can it be incorporated into ours, and what kind of program can we build that would work in Canada, and how can we replicate that program to work on our feeder system. Because for me to design something in Prince Albert that doesn't incorporate 1/3 of my business, be in northern Saskatchewan, when does the 1/3 become 50% or 60%? When you look at this, I think it's a global perspective, and I'll get into that. So I'm going to set the table a little bit. That's us in red with bylaw. That's us in green without bylaw. That's the other 3 largest cities in Saskatchewan, Moose Jaw, Saskatoon, and Regina. 3 of these police services are on the same RMS system. This is apples to apples. Now, that is based on calls of service per capita. And what that is, it doesn't really matter if we're busier than them. That doesn't matter. There's X amount of hours in a day. Here's what you do. Here's how you spend your resources. Here's your budget you do. But what this is telling you, using a simple investment formula, which we all use, that in 8 years, based on the same inputs, that our calls for service will double on the next 8 years based on the previous 8 years. So if you're somebody trying to make a decision in a policing capacity, would you have enough resources to keep doing what you're doing and meet the needs of what's coming your way? Can't do it, not possible. Can you imagine if Matt goes to your board and says, you know what, in 8 years we're going to double, we need to start building for that. That doesn't make sense. So the whole point is for us, we have to start thinking about our inputs. And that's what we'll get into here. So in Scotland, this is what we learned in Scotland. They built a timeline of a young fellow. This is a real live timeline called David's story. This young fellow was born in 1981 in Easterhouse, which is an impoverished area of Glasgow. He was born to an addicted mother who was a premature baby. Between the age 1 and 4, this family moved 3 or 4 times. No stability in the housing. He went to school at age 6. He was a premature baby. He was small. He was bullied. Time he was in grade 3, he became the bully. Continued to have no stability in the house, addictions issues in the home. Time he was between 12 and 13, this young fellow went on to lead the rival gang. Age 16, he's caught on CCTV camera going and doing a random murder. A guy gets out of a cab, doesn't know this kid, goes up and stabs him. Shows the police running him down, shows the police catching him. End up, David's caught. David goes to jail. Story doesn't stop there. David's in jail. Mom dies of an overdose. What happens to a young fellow? Social services comes in. Social services becomes the ward of David, and they put him in the care of grandma. Grandma runs an organized crime group in Scotland, one of the most significant organized crime groups in Scotland. All of a sudden, David learns the trade.